Hi, welcome to Psychological Awareness. This is a training and course that will help you promote your personal self-care, your coping skills, and your resilience, your mental and emotional and physical resilience uh, as a person, as you're working in your DTA, and how you best can improve that in the event of an emergency or disaster. So this can be applied already in your life as far as, kind of getting an idea of how well you're coping with your stress, with all the demands in your life, a fairly stressful job at times, and how you can improve areas of your life that you can cope with all the work that you do, and to be able to prepare for if in the event of an emergency or disaster, you have those coping skills already enhanced and set in place to help you through that and help your clients through that. My name is Kelly Morris. I am a licensed associate counselor in the state of Arizona, and I also have a son who attends a day program. And so I'm not only a clinician, but I'm also a parent who is directly affected by how well you are doing at your job, because how well you're doing directly affects how well my son does and how well I do. Because one of our concerns as loved ones is wanting to make sure that those who are caring for the individuals in our life who attend a DTA are respected, cared for, and prepared to deal with changing behaviors. Certainly, when there comes, if there's an emergency or disaster, that everyone will be directly affected, including and more specifically the clients, and how you are able to cope through that. This is also this training and presentation is in conjunction with Dads for Special Kids, their day treatment preparedness project, which your day treatment program is participating in, preparing a emergency disaster plan for your DTA. So you're an integral part of that, and your self-care and preparation directly affects how your DTA is going to prepare. The information that, a lot of the information that I'm presenting to you, I found from the National Center for PTSD, the National Child Traumatic Stress Network, Psychological First Aid Field Operations Guide, the second edition, and International Critical Incident Stress Foundation. And on a side note, if you're interested in learning more about psychological first aid, which is different than medical first aid in the event of an emergency, there is an online course you can take at PFA online, and we'll put the information on this presentation, and you can go directly to that site and take an online course and actually get a certificate of completion. Very interesting if that's something you're interested in, and it helps glean a little more information on what you can apply or where you're at, or just out in the community in general, because you are a care provider, and that would directly affect how well you can provide care for those in the event of an emergency, psychologically, emotionally. So the core actions of PFA is to respond to people who are affected by an event, disaster, an emergency disaster event, and how to help them cope and provide physical and emotional comfort. And that is kind of what we'll be going over today, how to do that in the DTA setting. And what the DTA is hoping to create is an environment where you're already in a DTA setting, and your clients may have to have extended care there, extended beyond the day treatment program hours from 8 to 4, however long you're at work, that you may have to stay longer. You may have to stay overnight. You may have to transfer to a different supporting day treatment program if something happens at your day treatment program facility. So this training helps you gain insight into your own resilience on how you would respond to situations like that. Plus, you'll learn a lot about how you're coping right now. And maybe there's areas, and there's always areas that every one of us can improve as far as how our personal care directly affects how well we do at work and how well we function in a stressful and an increased stressful environment. So we're going to be focusing on this part 1 of 3 trainings on how well you are beginning to realize where you're at with your personal health and mental health care, and particularly as you can approach your responses to an emergency or disaster during your time at the DTA as a provider. So, and again, like I said, we'll be inserting some slides so you can follow along on this. And I encourage you to take notes and jot down some thoughts that you have about your own personal response. Maybe you've already experienced some situations at work where one of the clients has had a rough day, or there has been someone who has run. You maybe have some runners, or those with behavioral issues, that one particular day more than another was very stressful for you. So think back about how you responded at that time, how you were affected before, during, and after, and that you can help the information that we'll talk about, hopefully you can apply to, well, how well did I do with this? And I'm pretty sure that you'll probably experience another one of those days. And again, like I said, as being both a clinician and a mother, I would hope that you're caring for yourself in the best possible way, because the way you care for yourself directly affects how well your clients are going to cope in a heightened state during an emergency or disaster. So personal considerations is to focus on how you assess your comfort level with the various situations you may experience. Working with individuals who are in a heightened state of distress and extreme reactions. Even in the mildest form of, say there's a client who, like my son, he's very structured and finds lots of safety and security in structure. So he's pretty sure about when it's time to go home. If for whatever reason he is not able to go home and has to stay later or stay longer or stay overnight or have to go to a different facility, he will have a stressful reaction. And so how you respond to helping him, your clients, transition through that, you'll also be in an increased anxious state, because this is not your normal routine. The clients may leave about 3:30, and maybe you take half hour more after they're gone, and do whatever needs to be done at the facility before you leave to go home. But you know you're going home anywhere by 5 o'clock, let's say. So what happens to you psychologically and emotionally when you realize, oh, I can't leave, or I've been asked to stay, or there's no way I can leave at this time? So you're going to not only be aware of how you respond, but also how others respond in an unfamiliar circumstance. The disruption of routine, both for you and for the clients. You already possess a certain level of tolerance for your position. You are aware of, I need to be calm, I need to be focused, I need to be attentive to this person, and the more agitated I get, the more the other person, your clients, are going to be agitated. So part of your job, I'm sure, and part of your training with the DTA is how well you work with clients. And some, I'm sure you have found you work better with some than others. And there may be a time in the emergency to where you will have to work with clients maybe you may not have as much familiarity with. So think about your personal considerations of how you would respond and how you utilize coping mechanisms to work with this environment and these changes. And it can get to where it's stressful to chaotic. It could get chaotic when we're thinking about an emergency or a disaster situation. Included in personal considerations, and again you can follow along on the slides, is working in an environment with minimal or no supervision, or conversely to that, with an unfamiliar staff. You may have a usual staff schedule with the usual managers on site, but for whatever reason, if something happens and that manager is not there, or they have switched schedules, or now you are working with a different group of peers that you are not comfortable with, you think about where you're at now, and those that you work with best, you just kind of have a routine, and we become very comfortable with that. If that's disrupted, how you cope and how you are adjusting to those changes, and also possibly if the environment is maybe at risk of harm, say the electricity goes out, or there's no air conditioning, or you have to be taken somewhere else, somewhere to where now your awareness of your own security and comfort level has been affected. So, how are you doing? Think about the areas in your life, and which also includes what are your highest priorities in life. So if you think about the top three most important pieces of your life, whether it's family, loved ones, your home, your pets, your well-being, whatever it is, those will be directly affected if in the event of an emergency you are unable to return home. So think about how you are doing right now, emotionally, psychologically, physically, how well you're doing, and think about those areas that you may need to improve. Are you involved in group activities such as exercise or family situations? There's things that you do that may need improvement. Does your health? Do you need to lose weight? Do you need to see a doctor? Maybe you're not dealing with stress like you used to. This should be a priority for every one of us. But sometimes life just gets very busy, and we just learn how to get the day done. And we need to be a little more aware of, well, where I'm feeling a little more stressed than I usually do. Where is that coming from? Feeling a little more tired or irritated. Where is that coming from? And what do I have control over? What changes can I make to modify that, to be better? So the next slide, it talks about self-care. Your physical health, like I was saying. Are you one that exercises? If you don't, why don't you? At the very least, even if it's walking around the block or utilizing, if you have a swimming pool, if you exercise at home, stretching, something to where you are getting physical health improvement, other than your work at the day treatment program. I'm sure you're very busy at times there. There's a lot of activity going on there. So you need to make sure your health, your physical health, is at the best place. Have you had any recent emotional or psychological challenges or problems? Has there been changes in your financial situation, changes in the job, loss of a loved one, a divorce, issues with your children, issues with their behavior or family members. Just think about those areas in your life where, oh, that's just really stressful for me. Have you had any significant life changes or losses within the past 6 to 12 months? In the event of an emergency, things like that will directly affect how well you respond and react to the situation, because you're already emotionally and psychologically strained and are trying to cope and recover from whatever that loss or challenge may be. And sometimes our brain doesn't know, okay, this stress is just about the power going out. It's not like when a parent died a year or so ago. It can't, our psyche can't separate. All it knows is now I'm feeling anxious, and that's how I felt when this situation happened, when this loss happened. Now I'm feeling anxious, and I feel like crying, and I'm getting confused. Whatever it is, that is a direct trigger for your brain. And that has a lot to do with trauma. When we think of PTSD, it's not just those returning from war. There's many situations in our life that, because of the trauma of the event, we are affected. Anytime you can think of there's a highly emotional event that happened in your life, or even if you compare it to, say, if there's ever been a time you've been rear-ended in your vehicle, and those first few times you get in your car and you're hyper aware of, oh my gosh, who's behind me? I'm braking too much. I'm constantly looking in the rearview mirror. That's kind of a lower end of PTSD, because your brain is trying to recoup from the trauma. Some things are harder to recoup from. So we need to look at how you're doing mentally, your self-care emotionally and mentally. And like I said earlier, the losses in the past will trigger similar responses to what's happening right now. If there is an alarm that goes off and everyone has to stay in the DTA for 12 more hours, that anxiety returns, and it's a similar anxiety that you experienced during that emotional time in the past. Okay, health considerations. Think about your physical health. I know we talked about exercise, but specifically thinking your physical state. Do you have any diagnoses of your own, such as high blood pressure or diabetes or low blood pressure, or you have specific dietary issues? Think about those health considerations. If you, in the event of an emergency, you're unable to leave the DTA. Do you have medications that you need to take at a certain time and they're not with you? Do you have to eat at a certain time? If you have dietary concerns, are those products and medications available for you at the DTA? Is that something that you can keep a box of at the program in case something happens, that you are prepared for caring for yourself during this time? Are you what is your ability to remain active for longer periods of time? You're very active anyway if you're working with clients at a day treatment program, whether it's in the program or out in the community when they go out and go to see a movie or bowling, out to the mall. You are dealing with getting in and out of vehicles and heat changes, and whether you have clients who have higher individual needs, whether they have they're incontinent like our son, or they need mobility assistance. things like that, to where at the end of the day you're pretty beat. If you have to stay longer and do that longer, how resilient is your physical state to have to do that? And is your ability to adjust to environmental changes? Like I said earlier, but how would I do if the heat or the air conditioning goes out? Do I have an issue with panic myself, and how I physically respond? Do I get heart palpitations? Do I get in an agitated state and I have a hard time breathing? Do I have asthma, and now the stress has triggered an asthma attack? Things like that, that only you know how best to care for you in that event. Moving on, thinking about family considerations. Has a direct effect on how well you're able to cope and focus at work. As the slide says, is your family prepared for your extended absence? If there's a reason that you have to stay 4 to 24 hours longer at work, and what happens with your family? Do they expect you home to fix dinner? Are you prepared to work in an environment where you're not sure when you're going to be home? How are you going to cope with who's picking up the kids? Who's going to fix dinner? How do I contact them? I pick my son up after I work. How do you deal with that? And what is your plan if something happens? Most of the time, we all have some type of backup plan, or this is our schedule, or John is going to pick up Zach at a certain amount of time if I'm not there, or I've got to be home for my husband at a certain time because he has to leave for work. Whatever the schedule is for you, how that's going to be disrupted. The next one. Do you have a support system, your family and friends, that can assume some of your family responsibilities while you're away? Who is going to pick up the kids if you're not available? Who is going to fix dinner? Who is going to feed the pets? Who is going to run to the store? Whatever it is, the logistics of that, keep in mind, and start your own plan of, I've never really thought of that. I really don't have anyone else to pick up my kids after work. I'm it. That's a consideration you need to keep in the back of your mind of whether an emergency happens or not. It would be best that you have a backup plan so you feel comfortable and safe knowing I'm not going to be stuck and in a panic because I don't know what to do. More family considerations is thinking about if you have any challenging family relationship issues that may make it difficult for you to focus on your work responsibilities. Maybe you have family members who will not do well with you not being home, and they make it very clear that they're upset that you're not home. Are there situations within your marriage or relationship that is strained? That has a direct effect on you psychologically, on how you're able to focus while you are at work, because those questions in the back of your mind of, oh my gosh, what are they going to think? How are they going to react? How do I get a hold of them? How do I explain it to them? How do I deal with them if they are upset? Or my kids. Now they're in a state of panic because mom or dad isn't home, and they have to be home. They have to be here to make dinner. Whatever it is of their reactions, it's going to make it difficult for you to set that stress aside and focus on yourself and the clients during this emergency, and how you communicate with that. And maybe that's part of your preparedness plan as well, is to sit down with your family and ask, how are we doing? And if something was to happen, what is our own plan? It's kind of like having an evacuation plan you used to do at school, or maybe the DTA practices an evacuation plan of, this is how This is where we'll go. This is the meetup place. This is who we'll contact. Well, each of us as individuals need to have plans like that for ourselves, logistically, realistically, and psychologically. Kind of have that file in the back of your mind of how best am I prepared for things like this. And say you have been at the program for however extended amount of time and you are done, you are exhausted, and you get home and your family expects you to be you. They have their expectations and their demands, and they want everything to return back to normal. Well, you may be wiped. You may not have the energy or the capability until you get some rest and recuperating time to get back to the normal schedule or the normal you in the eyes of your family members. And how do you prepare for that? And who will help you when you are home? Are there people at home, family or friends or whatever support system you have, that can come in and say, you know what, I'll fix dinner while you go lay down, or I'll take the kids for the weekend. Something like that, to where you need to have an idea of what kind of support system you have available to you. And are you a part of a support system for someone else? So part of those personal logistics is taking time to prepare for your family and other household responsibilities and the changes that may happen if there's a reason that you have to stay longer. An extended care is what we are calling it, in the event of an emergency, and you have to stay at the DTA. Who is caring for your pets? That's something to think about if you've got them. Your work responsibilities. Many of you may have 2 jobs. Maybe you have always worked a later shift and now you're asked to stay longer, or you worked your shift and went home and they're calling you back. How are your work responsibilities affected by sudden changes? And any other responsibilities. Maybe you're involved in other community activities or church functions or other roles to where you may not be available, or that may be disrupted for a while. Think about your involvements, your life involvements, and what would be affected. So this is the end of the first series of the 3-part series that we were introducing the different considerations on how to prepare yourself and how it directly affects your care right now. How best you are caring for yourself right now will have a direct effect on your clients right now, and have an effect on how well you will cope if, in an event of an emergency or disaster, you are asked to stay, or you have to stay without even being asked at the day treatment program, and how well you prepare for that. So think about your notes, make some notes, and we will move on to the second series. Thanks.